Hey YouTube, welcome back to another episode of Nursing Dynamics. I'm Dr. Ray. This is Dr. Pace Newburn, and today we are talking about a topic that we are calling nurses ruin nursing. And what do we mean by that? By that, we mean that we have noticed a pattern within the profession where nurses are responsible for some of the poor outcomes we're having. And we feel like that's a conversation that's not being had. We're big on self-reflection and taking accountability, particularly, of ourselves as well as our peers, from a professional aspect and a personal aspect to try to improve the profession. And again, this is our outlook. So engage with us. Let us know what you think in the comments. Starting off, we're going to talk about how nurses ruin nursing in terms of the academia setting. So I'm going to let Dr. Pace Newburn take us away.
Okay, so in academia, we want to start off with thinking about how did we even get to this point of us coming to this conclusion that nurses ruin nursing. And everything we're talking about is going to be systematically stated, in which is going to show you how it began to how we are today. So in academia specifically, we have issues that are rooted, truly rooted from the nursing education component. It started in nursing school. And so, how do we ruin nursing? It began in its inception at the program. So, in your average program, you have so many usually Caucasian instructors who are teaching whatever they're teaching to a variety of some diverse programs, and some programs are not diverse. Due to how education is set up, the administration may put pressure on said faculty to ensure success of the students. As a result of that insurance of success, the profession itself has, or not profession, that too, but the education component of the profession has been watered down. So when we think about what does it mean for a watered down educational system, it means simply that the standards that were put in place that were even before me don't even exist anymore, or they're again watered down. Okay, so it's like you take a drink and you pour water in it, it waters the effect is down. So you have alcohol, you put more juice in it or more Coke in it or whatever happens to be, it's watered down. You put more ice in it, it's watered down. Therefore, it doesn't give you the same effect. Same thing when it comes to nursing education. If we water down nursing education, our students come out or graduate not knowing what they need to know. They've been coddled, handheld, whatever you want to call it, to push them through a program that is not as rigorous, that is not as challenging, doesn't create critical thinkers. They don't know how to clinically judge. They don't even know how to pass medications correctly, as evidenced by, know that term, as evidenced by the latest investigations for nurses who have committed homicide due to giving medications wrong or incorrect or not at all scheduled or whatever it happens to be. So another component of watering down a profession may be, and I've personally seen this where we have had nursing educators, nurse instructors who will give students answers on tests. I've worked at institutions before where the students, and this is sad really, as a review, the students have, the faculty have went over a test, but they literally went over the exact test and then turn around or give them a study guide that looks exactly like the test for them to come back in on the following class, take the test, and get this, some of them still fail it. So it is watered down to the point of we're handing out test answers, or we're giving multiple chances that we would have never got back in the day. I know programs who will let you take a class 5 and 6 times and won't even fail you because they want the money. That is watering down the profession, which causes us to have incompetent nurses on the floor. When I say incompetent, I mean that you eventually pass the test. I would too if I took the test 5 times. You would think that repetition will cause you to remember something, but that doesn't credit you for being competent. That just means you have memorized something. And as we know, education is beyond memorization. It's about application, analysis, and above. So another issue is when we initiate the process of nurse bullying. That is also started in nursing school. And that is done from your instructors, from your peers. It's modeled by your instructors. Nurse bullying actually occurs to faculty, amongst faculty. So this is not necessarily just a nursing instructor to nursing student type bullying. That does happen. Of course it happens, but also from faculty to faculty. So it is modeled behavior that students pick up on as to be acceptable or whatever it happens to be, and it continues throughout their program and thus throughout their career. In addition to that, to kind of piggyback off of that, I have noticed a sense of camaraderie, friendship, buddy system between faculty and students. There's not an authoritarian type role where this is the instructor, this is the student. Because of this watering down, a lot of our educators are putting them at the same level, meaning this is the faculty, this is the student, just because we're both adults. But it doesn't work that way. Because I'm the one who has the expertise in the field, I have the degree that you're trying to obtain, and I am the authority figure that puts me up here and the student here. Not that one is better than the other in terms of anything like that, but we are not at the same level, hence why you're going to school. That waters down the profession as well. And then another thing is students not being held accountable for their actions. So when students are not held accountable for their actions, it allows or sets a precedence that I can do whatever I want to do. We call these also entitled people too. And this current generation has and is entitled for the most part, not all of them, thinking that they can do or say whatever, as if because you pay tuition, that means you're going to give me that degree. When that is far from the truth. The actual reality is you pay that tuition to see if you are a candidate to take the NCLEX. That's all that means. That's literally all that means. You pay all that tuition to see if you're a candidate. I don't guarantee your success. You have to do that. My job as the educator is to facilitate and guide that process. Your job is to actually put in the work to do it. And the thing is, there's been a miscommunication or perception that if I pay, I'm guaranteed to get. Do you know how many people pay for a driver's license and fail it? So therefore they can't legally drive until they come back and retake it again and perfect whatever they did wrong. It's the same phenomenon when it comes to nursing school. And I don't think people understand that. So when we talk about why nurses ruin nursing, the root of it starts truly in nursing education. And I'm not really going to dive into Florence Nightingale. However, she's a component of it too, stemming from the 1800s. In terms of the education that's being taught in the educational system, she is the mother of this, that, and the other, so they say. We are not inclusive of minorities in education. We make it harder for them to either get in programs, make it harder for them to stay in programs, as well as graduate from programs. And I don't think that's talked about enough. That is also why nurses ruin nursing, because you have a said majority, and this is not all of them, but a set majority whose initiative, whose agenda is to assure that ethnic minority nurses are not as successful in nursing as they should be. So I think those are some of the big things when I think of how we ruin nursing collectively, that ties into what we have today. It starts with our education.
Very well stated. I'm sorry, I was having a technical issue. All right. So piggying back off of that, I want to go into how does it show up in everyday practice? How does it show up in day to day when you see nurses ruining nursing? We could go on for hours ad nauseum. However, for the sake of this video, I'm going to start off with the bullying and catfighting. This is something that if you've been a nurse for any amount of time, you are very familiar with. The bullying starts in nursing school, as Dr. Pace Newburn has just stated, and it continues once you are in practice. There's a saying, nurses eat their young. I don't like it, but that's what it is. And it's because a lot of times, of course, not in every case, but a lot of times, as a new grad nurse, your preceptors and some of the other nurses you'll be working with tend to not be nice to you for any number of reasons that, could occur. They tend not to be nice to you. They tend to not be very supportive of you because you're going to have a large learning curve, and you may find yourself frustrated, and you go to these, let's call them senior nurses for support, and you are shunned, you are looked down upon, and you are basically not welcomed at all. And a lot of times they're rude. A lot of times it's not always a passive aggressive behavior. Sometimes it's very direct. It just, depends on the circumstance. So you have a lot of bullying, even amongst seasoned nurses. You'll have nurses insult each other. You'll have microaggressions, sometimes not even micro, sometimes it's a macroaggression. You'll have nurses that will turn your patients against you. They'll go in and talk to your patients and say horrible things about you, and you're with that person for the next 10, 12 hours. I've seen that. I've seen where a day shift nurse will talk bad about the night shift nurse, and then you got to be there all night with that person, and after your colleague has said something unfavorable about you, when we're all nurses, we're all supposed to be in this together, right? But instead of addressing those issues, we're clawing each other's eyes out. The cat fighting, so many examples can be said with the bullying and the cat fighting. Everything from arguing over an assignment to I've even seen, in as crazy as nurses, I've even seen nurses fight over overtime. There's one extra shift and two people want it. I mean, all sorts of things.
Split it.
Yeah,
the shift.
You can split it, exactly.
Mm-hmm.
I've seen everything from people arguing over assignments. So I don't want room 312. Or I want 312. Don't change my assignment. To sometimes the nurses will deliberately give you the worst assignment. They'll give you all the patients that have issues that require a lot of attention, which is fine. As nurses, we're trained to do that. But when you have a lot of patients like that, and then it'll be the day that you don't have a tech or have any help, or you'll always be the one to go over matrix and everyone else is not. I mean, just any number of instances that you can think of where they're just deliberately making your experience harder than it has to be. So you see a lot of that. You see a lot of that, and it contributes to stress, burnout, and just overall feelings of dissatisfaction with the profession. And a lot of times there's issues in nursing, such as, but not limited to, pay, racism, and working conditions, and just to name a few. And rather than taking that same energy that we use to fight each other and kind of come together as a collective and deal with the system at large, we rather just fight each other at the nursing station, and that gets us nowhere. And transitioning into that, Dr. Pace Newbern is going to go into exactly that, how nurses tend to not work together.
So how they don't work together, and we're going back to now we're on the floor. Typically, when I say when we don't work together, we are speaking that, keep in mind, and this happens in other settings as well, but majority of your nurses populations you're going to find in the hospital setting. So I'm kind of, even though you will find this in all settings, but the one that comes to mind really, because that's where the healthcare infrastructure is based off, is the acute care setting, which is in the hospital. She mentioned, Dr. Ray mentioned the pay already, that we don't come together when it comes to that. Maybe that one person who, most of us feel like we don't get paid enough, but at the same time, there's people like, well, I get paid, I get paid this much dollars per hour. I get paid this much dollars per hour, or even to the point where they have turned us against each other, because at least in the state of Tennessee, and maybe other states too, you're not allowed to talk about pay at work, because for one, they paying somebody else more than they paying you, and you may have been there for 5 years. The new grad will come in making more money than you, and you've been there for 5 years, and you haven't gotten your pay raises, or you get your 2%, 25-cent raise. So they make it to create discourse amongst ourselves that we can't even talk about that. To piggyback on the working conditions, and you mentioned about going over matrix, and that's the one thing we're supposed to be fighting for, to have safe staffing. But then you will have these 2 or 3 nurses who always, now see, I'm not gonna lie to you and say I haven't won over matrix. I don't mind taking one for the team every so often when we all are working equally as hard. And in my situation as an OB nurse, we have had situations where labor and delivery was standing room only. All the beds was full. People waiting in the lobby to have a baby, literally, because it's time. We're just packed. And so, but we have open beds on our side, but yet my patients hadn't went home yet. And if they're stable, I don't really care. Okay, you know what? We are all jamming. If something happens to that woman in that waiting room who's actively in labor, and I have a bed on my side and I take it, that's one thing. But that is an exception, not a rule. We don't have that happen every day. But we do have nurses every single day, every single shift who say, okay, because I want to be a team player. I want to do this. I don't want to make anybody mad. I'm going to go over matrix. You can do that by yourself because I'm not doing it. And then when I don't do it and stand up for my rights and protecting my license, I'm the one who's not considered to be a team player. This is how we don't stick together. This is how you all are ruining nursing by taking these workloads, these patient loads, shall I say, that is not conducive to not even you, because you're going to give poor care. The more patients you have, it's statistically noted that your care is going to be less. I mean, that's just common sense if you think about it. You know, I can't take care of 9 patients to say, well, I'm going to take care of 5. It's just common sense. And so that's something that we always you always call yourself trying to go over and beyond, but yet you're hurting your whole team as a result. And they'll be the ones who get the Daisy Awards. The ones who follow the rules, the rest of us who follow the rules, and like I say, and when I say follow the rules, meaning that we're gonna protect our license in doing so, we don't get recognized. It's the ones who go over and beyond, and you know, they came in and worked 15 shifts in a row. Well, they about dead, but yes, they did. So they get the Daisy Award. But because we want to have our self-care day, we want to make sure that we rest and come back with a fresh mind when we come back to work. Because you realize that if you go without so much sleep, you function, your brain functions as someone who's intoxicated. Mm-hmm. And I've experienced that. I was up for a whole 24 hours and worked 2 days in a row. And I couldn't tell you A from B, barely. Didn't know I was going or coming. Was it day shift? I was just delirious, really was. So I think that's part of how we don't stick together. And then, you know, talking about there is no support for BIPOC. Well, I don't want to say no because I don't want to use those terms that are totality kind of terms like never, always, because they rarely exist in nursing. But there is very little support for BIPOC nurses in the healthcare setting. So we had this whole march, right? They couldn't even get the march together. They organized the march back in May, Nightingale's birthday. They had a march in DC, I believe, and thousands of nurses came out to this march. And this was this huge initiative to have legislation talk about ratios, discrimination, which we had to fight tooth and nail just to get that on the agenda because the white supremacist white nurses, and I said it, didn't want that on the agenda. So we could talk about that at another time. Of course, that was their agenda. That's why we can't come together. We have the issues with that. We have issues with the fact that we as BIPOC nurses sometimes can't get certain roles. We have white nurses with an associate degree in a management position, but I've been a nurse for 10 years with a bachelor's degree, but I'm not qualified. Neither were they. You know, so we can't even rise in the profession. We're not supported in the profession. We get difficult patients and people don't come to our aid. We don't have allies in the profession. The leadership don't really care about us. They want to sit there and have this diversity, equality, and it's DEI, diversity, equality, and inclusion, I think, initiative that these places, this is a trend now. They are using these as catchphrases now to say, okay, we're on the latest trend and we're going to hire 5 people who look like from the BIPOC community just to have them on there. Put one of them in a commercial, maybe. You may not see one in a flyer. You may see their vignette, their blurred vision in the back, they Black, but they're going to sit there and not even do that, you know, to make sure that we are all inclusive. We don't even feel like we have a seat. We don't even feel like we have a seat. No, not even a seat. We use the phrase of having a seat at the table. We're not even in the room. And when we're not even in a room, we can't be a part of the conversation. For one, if we're not sitting at the table, we can't be there to have these conversations about, okay, how can we create change to make nursing better for everybody? Because is it truly about healthcare? That's what we claim it is about. We want to create these changes about healthcare, but the thing is that if that was an agenda, we would have fixed that a long time ago.
Yeah.
Healthcare won't allow us to do it as a whole because big healthcare is all about the money. The sickest people are the ones who are typically, not always, typically middle class, poorest people. So we have health disparities that nobody wants to look at. And we don't even understand as nurses, BIPOC nurses versus other, how we treat our patients who have said ailments, who come from certain areas, rural, or just they happen to be African American or whatever type of ethnicity. Maybe there's a language barrier. We don't treat them well either. But yet we say we want to have solidarity, some unity, things like that. We only say that when it meets certain people's agenda. So us being BIPOC nurses, a part of that group, we definitely see things through a different lens because of the fact that we live it, we've worked it. There's been struggles to even get to the point where we are now, because people who don't look like us can sit there and take not even do a fraction of what we did and still come out even better than us. So that's kind of what I think when it comes to how we don't come together. You know, everything like I said, from the march, supporting the BIPOC nurses, and then going over beyond when you're doing too much and you're not really helping our agenda as a collective. You're helping yourself so you can get that Daisy Award or whatever happens to be, that pat on the back type of thing.
Excellent. I think you summed that up very well. I'm going to go into one other point that I noticed with nurses and how we further disservice our profession is a lot of nurses are all talk and no action. Nurses love to complain. Yes. And will complain and talk smack and do nothing. And the thing of it is, if you have one or two that actually want to take action, it's not enough. That goes back to what Dr. Pace Newburn was saying about how we have to be a collective. Because if it's just I'm just gonna use myself as an example. If it's just me and Dr. P, we're like, let's say we work somewhere together. We're like, okay, let's do such and such, but we're the only two that's speaking up about, we're the only two that's really pushing for it. It's just like you just pluck those two people off and you just keep going. So it's not enough to just talk about these issues. You have to have action items that can actually be carried out. But again, it takes a collective, because another thing with nursing, people always talk about this nursing shortage, which there is none. There's just high turnover. But nurses are a dime a dozen. They really are. People with nursing licenses, a dime a dozen. So that's why it's so important for us to stick together, because if it was truly a shortage, it probably wouldn't be as hard to get people on the same page, because it wouldn't be so many. But you're talking about, you have a flood of people in this profession. Everybody's going like this. Nobody's going like this to try to say, okay, here's a problem, let's fix it. Everyone's all over here. So, and because we're so divided is why the profession is the way that it is. And it will continue to be this way until the majority, because it's never going to be 100%, but we need at least the majority to be on the same page. And people will talk a good game, but do nothing. They'll do nothing, even from as small as your local community hospitals on up. And in order to impact change in a system that is the monster, a healthcare system that it is, you're going to need collective action. And some kind of way, you're going to also need to affect their financial capabilities, whether that is stopping the cash flow or adding to it. And that's, you don't have to like it, but that's facts are facts. Because as long as the system is still making money and everything's going good on the business side, what reason does the system have to change? Because it's working for them. They're working the way it was designed to work. But nurses, as a collective, I think more nurses are unhappy with their profession and things about them than are totally satisfied. So that said, but in two of the big topics, like we said before, are pay and working conditions. And even with those two things that the majority of nurses have issue with, we won't even come together for that. So I think nurses spend more time fighting each other than to actually taking that same energy and putting it together to invoke change. So there's a quote from Lil Wayne that I like to think about when I think of situations like this. He has a line where he says, "Today I went shopping and talk is still cheap," and it is. So talk is on sale. It's on clearance. Talk at the Goodwill. So we can talk, we can talk all we want, but until you come together and put some action behind those words, it's just hot air.
So what do you think? What is one thing that you say that, I mean, you said that's what we could do, but like, what does that actually look like in somebody going to work? So in academia, that would mean for us to come together to make this, so for us to truly come together to say we are not ruining nursing. In academia, that would probably look like holding students accountable, holding faculty accountable, teaching at the level of rigor that that they need to be taught at, not just passing people because of a thing. Now, mind you, you may be having to buck the system in terms of, people say, well, we can't have all these people who fail. Well, you know what? Vet the people to begin with when you bring them in.
Mm-hmm.
So have some type of standards when you bring them in. So, you're going to lose people anyway. That's a good program. You're not going to pass everybody. Or I'll say you're not going to pass everybody. They won't pass. But what does that look like to you? Okay, so we're past nursing school, we on the floor now. What does that look like? What does that look like physically? What would I see? What would be the action steps that nurses would be doing to remedy the situation?
Doc, that's an excellent question. So I'll give a few examples. Starting off with, let's just start with low-hanging fruit, staffing, okay? Starting off with staffing, because that seems to be a big issue everywhere in terms of working short and working over matrix. That would look like, and again, depending on the circumstance, depending on what this would look like, but again, it takes a collective. That would mean that when the admission person calls, or whoever calls to say, we're sending you more patients and all the nurses are at capacity, that every nurse refuses that assignment. Okay. And I already know somebody's gonna say, and what about the patient? Do you want to do this or not? Mm-hmm. Do you want to do this or not? Now, certain times I get like what Dr. Pace said about, you got people about to have babies out in the lobby. But let me tell you something, and I know I got unpopular opinions, and here's another one. That ain't my problem. Why is it not my problem? Because I don't staff this facility. You need to staff it appropriately. For example, something like L&D, people have babies all the time. It might not even be a patient who was affiliated with the hospital. Mm-hmm. Women are amongst us at all times. At any given time, someone's pregnant and could go into labor and could be completely unplanned. Maybe somebody was visiting from out of town. Mm-hmm. I mean, we could draw up a trillion different reasons, why people come to the hospital, and the video will go on forever. But that is why you should staff your hospital appropriately to ensure that when things like that happen, you have people in place. So an example, I'm going to use that example Dr. Pace Newburn gave about you got women in the lobby having babies. Okay, well then, even if you want to say everyone refused the assignment, at the very least, until you have confirmed that the nurse is on her way, his or her way, her, they, who however they identify themselves, are on their way. Okay, then let's do it. Go ahead and give me the patient until so-and-so get here. But that's not my problem that they don't staff the hospital pro, because now what you're doing is you want to pay me to do someone else's job. Because first of all, the problem is not with me. I have my assigned number of patients that we have deemed is safe for this level of care, whether it's 1 to 2 ICU, whether it's 5, 6, whatever it is, wherever you are. But now you're telling me I'm supposed to take 7, 8, 9, and I've even seen 1 to 10 ratios in the ED. No, you need to staff this facility is what you need to do. So, a lot of people push back and say, oh, it's the patient. You can say that for everything. But let me tell you something else. If it was really about the patient, we wouldn't have these issues in the first place. If healthcare was truly about the patient, we would not have these issues to begin with, or they would be severely minimized, or actually getting worse if you follow the healthcare trends in terms of staffing. In terms of pay, what does that look like? That looks like not accepting these low ball offers that I'm seeing. APRNs, knock anybody home, because APRN is famous for taking low ball offers. That's understanding that when you're up for a raise, how to negotiate said raise. That also means to talk about what you're currently making. Be transparent. We already know that 9 times out of 10 you're not rich anyway, and if you are, it's not because you work as a nurse. You probably got something else going on. Let's just be real about it. So, and to say that you're not supposed to talk to each other, that's actually illegal. I learned that from an employment attorney. You can't tell me that I can't talk about how much I make. That's my business. You can't tell me I can't talk about that. That's my personal data. So to even say that is actually illegal, and no one's holding these facilities accountable who scare, that's all it is, a scare tactic into nurses into not talking about pay transparency, because frankly, we're all doing the same job. And I don't necessarily expect everyone to get paid exactly to the dime, but it should definitely be fair. And again, taking these low ball offers. So if you see, like things, for example, they did a thing on TikTok where it was nursing transparency. My first job as an RN, fresh out of school, 2007, was $28 an hour in the SICU. So I'm seeing nurses getting paid less, or even at that rate today in the same area, because then I know we talk about depending on where you live, got that. But even in my vicinity, I'm still seeing nurses starting off at 26, 27, $28 an hour. How many years has it been? So the other part of that is that we accept it. People can't do to you what you won't accept, but again, it has to be a collective effort, because just one or two, 3, 4, 10 nurses saying no is not going to be enough. It has to be a collective. But because we have talk is still cheap, and we have a every person for themselves mentality, we will remain here. You keep doing the same things, you'll get the same results.
Okay. All right. So that kind of sums up our video for today. We really want to kind of dive in and talk about, how nurses ruin nursing. We talk about, at least on TikTok, we talk about the healthcare system and how the healthcare system has hurt us, and how the CEOs make all this money, and how the hospital makes all this money, and how the hospital doesn't care about us. And all that is true. That we're not taking away from that at all. All that is actually very true. However, the point of this video is to say that we do it to ourselves. And, we help them in that. And then we have no initiative or very little initiative, shall I say, to do anything about it. And when we do, and, it's kind of like how she was talking about how talk is cheap. We talk about it, don't want to be about it. We be the same ones at the nursing station griping about, I can't believe I have to work, all these things. But when it comes to the monthly meetings that we have, the monthly unit meetings, y'all sitting like cricket, like church mice. Can't even hear them. So there's no point of complaining. Either, if have your event session, keep that to yourself. Because if you don't plan on doing anything about it, you don't plan on quitting, what does it matter? And I'm not against event sessions, but the thing is, you will come into work with this same attitude. We all have bad days. I can't believe we all have bad days. But it's the people who have the same attitude come in every single day, and they're like, we always have to work over matrix. You always have to work over matrix. I don't. Again, there's been exceptions to that but it's very rare. And I still don't mind, even still in those rare situations, because in the situation that you were just talking about, all our staff was there. Everybody was there, plus the people on call. It was just a bad shift. And there are days where we do work short because people called in. That's one thing. But this what happened that particular day is literally we had all our staff, all our on-call people, so they staffed appropriately. But the thing is, once you have made all those phone calls and said, "Can y'all come in?" and they say no, you can't fault them. You can't fault the nurses who don't want to come in on their day off. So we had all the staff. We just had too many people coming in. And then the hospital, the Fort Campbell, the military hospital was on diversion. So we got all theirs too. So it was just one of those situations. It was just a bad shift. And we couldn't change that no matter who we had. They even brought up other nurses from other floors. But guess what? If you're not trained in L&D, what can you do to help us? Not L&D, but the whole floor. You can't help with no babies. You definitely can't deliver none. And you can't even get into our charting system for OB. So they get delegated to do like vital signs or things like that because they can't do nothing to help us. So we, in that situation, that's what I'm saying. Sometimes there are some rare situations where you do have to do what you have to do. But when they make this an everyday phenomenon, when you have nurses sitting on the other side who literally have no patience because you scared, because they're gonna get mad and report you. Well, they didn't take their patients, and we don't change the shift. Don't stop no patient care. Da, 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 da. Yes, it do. That's why it's called change the shift, unless it's an emergency. Now, if somebody's coding, then no, it don't stop for that. But there is a natural break in care. That's the reason why what I don't do, guess what we have the next shift do? We have a break in care. Give report. And again, if I'm busy, got something going on, I'm gonna continue with my care until you can come over and take over. But in a normal situation, that's not how it works. So, but like you said, I have a story about that where I refuse to take, I said, I'm gonna go to the house. Y'all can go ahead and take 10 patients piece if y'all want to. Because I'm going to the house. They're like, no, you go ahead and take your 6, we'll take 7 apiece. I'm like, okay, cool, not a problem. And then I took first admit after my patient went home. But we're gonna have to learn how to speak up enough to the point of, I keep saying this, do I want to keep my license? Because that hospital, when somebody dies on your watch, if that happens, and when that hospital lets you go, mind you, they ain't never gonna admit that they told you to go over matrix. Ain't nobody ever gonna admit that. And when you go and you lose that license because somebody died, they're gonna sit there and say, well, why come you went over your matrix? What you gonna say then? You blame the hospital? Yep, humming and carrying on. I'm like, no, that ain't gonna be me, because how I take care of my kids is based on that license. Me having that license. And I'm not in a position to go back to school to do nothing else at this age to make the same amount of money, even though, we talk about nurses don't make a whole lot. They make good enough to where they don't have to work at Walmart. Most of the time. There's some people around here, I'm kind of like, you was better off at Walmart. Without as much headache, but it is what it is. So anyway, we wanted to just kind of talk about this and bring this back home and simply say, we as a collective, as nurses, have got to do better. We got to do better. If we want to create change for the next generation of nurses, we have to do better. But the truth of the matter is, Dr. Ray and I, neither one have any faith that it will take place. This is just to bring you insight, shall I say. But what I do say personally is, because I'm an educator at this point, I personally make it my daily mission to make sure that behind my name, students who come from me, that they got the rigor, the education that they should have had. They are not coddled. They are not those types of things. So I can only control me and the outcomes that come from me. I can't control what other 4+ million nurses do. I can't control what other 4,200 plus nursing programs do. I can control Dr. Pace Newburn's class. Any parting words before we go?
No, I think that was great. I hope we gave some insight to those of you who may not be as familiar with this aspect of the profession. And again, if you have any questions, comments, or concerns, leave it in the comment section. We would love to interact with you.
As per usual, if you could follow us on our social media platforms, on TikTok and on Instagram, the same handle at Nursing Dynamics for both. And also, you will see, if you look at the banner at the top, you will see an Amazon icon, in which that is our storefront. We have vetted some great materials for nursing school, whether it be NCLEX prep, anatomy and physiology, everything from, even at the doctorate level, things that we recommend to get you through your programs, as well as different tools, watches, calculators, stethoscopes that you can use to help you on your nursing journey. Feel free to go through that storefront. It's called Nursing Essentials, that you'll see, and see the things that you want. If you want to get things through the storefront, we really appreciate it. Also, we have on there our personal items such as skincare, hair, and such, that things that we use on a day-to-day basis to achieve the looks that we want for our self-care. So basically, we appreciate your time watching this video to the end. And as usual, you all take care. Bye-bye.